And so I think I'll begin. Welcome, Dr. Montgomery Rice.
Thank you for having me.
So I have to say, I went through a number of your videos and I've been at many of your presentations. We are truly happy to have you back with us here at Georgia Tech in our virtual room. You've said previously that failure may come. It's part of the path. Without failure, there is no resilience. Without resilience, there is no strength. Really powerful quote. As you contemplated creating the Center for Women's Health Research at Meharry Medical College, I'm certain you could see many opportunities for failure. And I think that grit that you've really presented in all of your work is foundational to the resilience that led you to being able to found the center. For those who may not know, the center is one of the nation's first research centers devoted to the studying diseases that disproportionately impact women of color. Dr. Montgomery Rice, would you tell us about your journey in establishing that Center for Women's Health at Meharry Medical College?
Well, thank you for having me. I'm excited always to do anything for my alma mater, Georgia Tech, which I always tell people is still the hardest thing that I've ever done. Georgia Tech was the hardest thing that I've ever done. And so when I think about really resilience and grit, I learned a lot of it at Georgia Tech, because when I was at Georgia Tech, we were on the quarter system. And I started out as a Chem E major, but once I got a job offer for Procter & Gamble, recognized that I really didn't want to be an engineer and decided to come to medical school. I'm sure we'll get into that. But when it was time for me to really think about the Center for Women's Health Research, I had come to Meharry Medical College from the University of Kansas, where I had spent most of my early part of my career. Once I finished my fellowship, that was my first job. And myself and a colleague started the Division of Reproductive Endocrinology and Infertility. And one of the things that I started to figure out early on was that women of color were disproportionately impacted by some diseases. We tended to have more fibroid disease, we tended to have more tubal disease, and we tended to have more endocrine disorders that prevented us from becoming pregnant. And I started to delve into why that was the case. And there were a host of reasons. Part of it was access to care, access to quality care, and access to care in a timely manner. And so fast forward, I've been doing reproductive endocrinology. I've been doing my basic science research. And when I was asked to come down to Meharry Medical College to be the chair of OBGYN, the work that I had been doing in research followed me. And we thought that we were at one of the most historically Black medical schools. Why don't we really focus on what are the root causes of the disparities that we see in women's health? And so I applied for an NIH grant, got a $10 million grant from the NIH to study this. And we focused initially on looking at reproductive changes that influence women's ability to get pregnant, but also to develop disorders like fibroid disease. And then it spilled over into looking into breast cancer and endometrial cancers and endometriosis. But the whole point of it was we wanted to answer the question of why. And it wasn't easy because there were not a lot of people interested in the why of it. They were more so interested in, okay, what can we do to treat it? But we were talking about the why. And I think for the number of times that I was told no, I was pushing toward yes. And that resilience and grit, a large part of it was some of the challenges that I had at Georgia Tech.
That's great. There are a number of things that you said that really strike a chord for me. So, and the most recent one is you said you were trying to answer the question of why, but it was hard because people didn't really want the answer to that question, right?
Right.
And it's challenging when those core questions of why, to understand the foundation, the root causes of these issues, are critical to us, but the funders, the decision makers may not see those as the important questions. How do we push through to make sure that those questions really are answered when oftentimes the decision makers who are funding these projects may not agree?
You know, what I have found, and I have, I served on at the NIH on study section for probably the first 10, 15 years of my career. And then I started to sit on a lot of the institute and centers there. We're working on advisory committees. And what I have always found is that there are always like-minded individuals in the room with you. You just have to figure out what the likeness is. And so it means getting to know people and building relationships and then introducing the questions in a way that resonates what's important to them. And this is something my mother used to always tell me. You can get a lot more people, whatever she used to say, with honey. And I was like, okay, don't tell me any of these colloquial terms. I don't have time for that. But she was always correct in that, kill people with kindness. Treat people like you would want them to treat you. And what it really was about is listening to people's story a lot of time and figuring out what was important and then connecting the dot of what's important to them to what's important to you. And so what I have found when I was trying to, and we're still at this, right? We're still in the middle of this right now, trying to ensure that people understand how important it is for us to have equitable distribution of the vaccines, such that we will not see people disproportionately impacted by this disease any more than they already are.
Yes.
That is really, really critical. And so getting to the commissioners of health, the Department of Public Health commissioners, the governors, and all of those people, and ensuring that, first of all, they have the data that shows the disproportionate impact of Black and brown people with this disease, and that we don't get caught up in some of these stories of vaccine hesitancy in our communities that is predicated on a lot of historical facts, but that we focus on how do we get people to vaccine acceptance. And that begins with acknowledging people's concerns about mistrust and distrust with the health system, and then answering their questions.
Yes.
And when we don't know, saying we don't know, but then bringing them back to the data to say, these vaccines are another thing in our toolkit to fight this deadly disease.
Yes. And that exactly goes to this notion of answering the question of why, in addition to one of the things you've noted is, everyone has a story. Be proud of your story. And if we, as scholars and clinicians and the many folks, engineers and others on the call with us tonight, if we can tap into the story that our communities are not sharing for fear that it's not the right story, that it's not the majority story, then how do we ever get past the bias in the healthcare system? How do we get to this space where, with COVID now, we can get to communities, really Black and brown communities in particular, accepting the vaccine and allowing us to realize a better state for our nation and world?
I mean, I think a large part of it is, again, seeing people for who they are and assuming that everybody brings value to the table, regardless of what degree they have, regardless of what their skin tone is, regardless of what their gender is, and that their story and how they have persevered through their story is actually going to add to the richness of the solution.
Yes.
All of us know that when you're dealing with complex problems that you're trying to solve, you need what we call cognitive diversity around the table. You can have all of the mathematicians and statisticians to solve the math problem of how are we going to get the distribution of the vaccine based on where the disease is showing up, and based on the fact that of this racial and ethnic breakdown in a community, they ought to get this number of vaccines. But it's just a vaccine. It doesn't become a vaccination until you get it in somebody's arm. So you need to have the community activists. You need to have people who look like the people who you're trying to get the vaccine in. You need to have people who can talk to people and engage them in a culturally and a linguistic way such that they understand, and you acknowledge the historical context, but you don't let that history hold you back from achieving the future. And so it takes people who've had diverse experiences and who have diverse thought to help us solve, these complex problems.
Absolutely. So let me mention something that your mom used to whisper to you. So you say in one of your talks that your mother would whisper to you, "All things are possible. There are no limitations." And this is when you and your sisters were fast asleep and she had just come home from night shift.
Yeah.
What are some of your successes in the creation and advancement of health equity you are most proud of? And are there any specific stories you'd like to share?
I think that I didn't always plan to go to medical school. I really did decide to go to medical school because I decided I didn't want to be a chemical engineer. Sorry, Kimmies. But Georgia Tech was really, really hard. And even though I know I would have made it through, I was in my 4th year, I recognized I didn't want that for a career. And so one of the things that I am most proud of, that I find I was empowered enough to change my mind. I mean, because really, I had a job offer. I had co-op for at least 6 quarters, I think. And so I was well on my way to becoming a chemical engineer, but I knew that I wasn't happy. And so, and I don't know that what I defined happiness was, but I just couldn't see myself doing it forever. So I really am proud of the fact that I was brave enough to change my mind. And I think, having the work ethic and having grown up in a household where there was a strong work ethic, that made a difference. And then when I got into Harvard Medical School, again, I didn't quite appreciate how big of a deal that was. I got into every medical school I applied, actually. But, I did decide to go to Harvard Medical School and turn down a full scholarship at another institution because Harvard was not giving academic scholarships at that time, right? And so I went to Harvard Medical School and I had a great experience. I then made the decision that I wanted to be a reproductive endocrinologist and fertility specialist. And there were only 20 spots, and this is a fellowship, so you have to do 4 years of OBGYN, and then you do a fellowship afterwards. But there were only 22 spots in the country. And so I knew that I had to make myself competitive. And so I spent my entire 4th year, instead of going away and doing electives, etc., I spent it doing basic science research so that I could make myself competitive 4 years later. 4 years later. And so one of the things that when you were at Georgia Tech, you knew that you had to be disciplined, particularly on the quarter system. So 5 and 6 o'clock every evening, we were in the library. Okay, so the discipline. So I'm proud of the discipline that I've been able to carry throughout my life. And then when I became the dean, the first time I became the dean at Meharry Medical College, I was the youngest dean in the country. And so I think I was pretty proud of that. Again, I'm proud of it now, but I wasn't necessarily thinking about it then. I was thinking about how overwhelming it was. And then to come here and be named as the dean and president and the first woman to lead this freestanding medical school. I was the first woman of color to be named to lead a freestanding medical school. So I've had some proud moments, and then personally, the most proud moments is I have two wonderful children, and my daughter is a graduate of Harvard Medical School also, and my son is an environmental game artist, and then I married a Georgia Tech graduate. My husband was a chemical engineering major from Georgia Tech. And so we've been able to be very fortunate, and we've centered things around our family, but we've definitely been able to advance our careers because we supported one another so much.
Wonderful. Well, I have to say there's a poll open, and so I'm going to direct our audience to please go to the poll so we know who's with us. The options include a number of Georgia Tech options, from undergrads to faculty, Atlanta community members, and future Yellow Jackets. One of the options there is not Harvard students, and I have to say my daughter is a Harvard undergrad, and a number of her friends are joining today. Happy to hear from you. Many of them are studying health disparities, so thank you for the model that you're presenting, not just to the Georgia Tech community, but to this digital community. So in your last comment, you mentioned a lot of we, community, your circle. You've mentioned previously that you should surround yourself with people who add to your inner strength and value your gifts. Can you say a bit about that circle, those people who you surround yourself with, and how they've supported you to have such a big impact on health equity in our nation?
You know, for me, education was clearly the equalizer. I mean, growing up in a single parent household, my graduating class for high school was 1,049. Okay. I only got to Georgia Tech because my science teacher said I was the only Black child in the honors program. She said, "You're great in math and science, and they're looking for Black kids to be engineers. You should go to Georgia Tech." Now, when I think back on my scores and stuff, I probably could have gone a lot of other places, but I'm really glad I went to Georgia Tech. But that was the amount of counseling that I had, right? And so I came to Georgia Tech, and it made a big difference. And I had great support there. The OMED, Office of Minority Education Development, I think that's what it said. That was a great saving grace for us. My sorority, Delta Sigma Theta. But you also know Dr. Pettis, who was the president back then. I mean, he spoke to the Black students a lot. I mean, we tried to probably do some standoffs in his office and that kind of stuff, but he was actually pretty open to talking to us. And when I made the decision that I was going to go to medical school, my advisor thought I should stay and just finish my chemistry degree and then go to medical school. But I was really bent on the fact that if I got that engineering degree and took a job, I probably wouldn't go back. I went to one of the advisors and asked them, because you didn't need a degree to go to medical school. I just needed to take the prerequisites. So they let me take biology courses together. And the chair of the chemistry department, I believe he was the chair, said to me, "You shouldn't leave here without a degree. Your mother worked too hard for this." And he said to me, "Let us see if we can get you to take, because you had to take a senior level chemistry course. And because in chemistry, all the courses pretty much were the same. And so he arranged for me to be able to take that course so that I would leave there with a degree." So that's the level of support that somebody looking at your career, he knew it was important for me to have a degree. I didn't think so at the time. And I have always been so lucky to have that level of sponsorship and mentorship throughout my career. And it has not been people that looked like me. And that's one of the things that I will say to people. It's great when you have someone who looks like you, but that is not always going to be the case. And when you build relationships with people and they see that you're willing to work hard you'll be amazed at how people will tap into your life
Mhm.
and give you just a carrot of information that will carry you so far. And that has happened to me over and over again. And so when I think about what my job is now, is to extend that opportunity and to do just that, to continue to speak to people, to continue to open doors, to move it from mentorship sometimes to sponsorship. And sponsorship occurs when you don't have a clue that somebody's in the room talking about you and
Yes,
talking about what you can bring to the table. And you get that call. You know that someone has sponsored you at that point.
absolutely. Having those people who are on your advisory board, who you
Yes.
know are advising you directly, and the
Yeah.
people who are in the room who are speaking on your behalf, but you don't even
Mhm.
know about.
They don't even know about it. And the thing I also say to young people is that it is so important when you ask people to be your mentor that you show up, prepared. You understand that these people are giving you a gift, and that is the gift of time, their time. And you should come prepared for the discussion, and always presume that they have your best interests at heart. It is a bi-directional relationship. I get just as much out of mentoring someone as I hope that they get out of me mentoring them.
Yes. When I speak to my students about this very thing, I encourage them to be honorable.
Mm-hmm.
Be honorable in the commitment, because it's not just the commitment that the mentor is making to the mentee, but you as a mentee are making a commitment to that mentor.
Exactly.
And paving the way for others. So we have an abundance of undergraduate students. 60% of our attendees are Georgia Tech undergraduate students. 28% are faculty and staff. 9% are from the Atlanta community. 4% are GT graduate students. So welcome, everyone. If you have questions, please begin to populate the Q&A so we can engage in those questions as we go along. So let me ask you one more question here, and then we'll see what we have from the audience. I do at some point want to get back to the COVID response and where we are and how everyone here on the call, what steps we can take individually to make sure that we have the broad public health that we need as a nation and world. But let me ask this question first, Dr. Montgomery Rice. As a Georgia Tech alum, and you gave us some advice already, what advice would you give to current students on how they can use their future careers, whether it be Chem-E or something else, to affect positive change in the healthcare sector?
So, what I would say to our students that, first of all, your first degree is really just the foundation. I cannot tell you the number of my colleagues who graduated from Georgia Tech with engineering degrees and are not engineers now. But they have maintained this model of being a continuous, active learner. And that is what I learned at Georgia Tech, that the learning never stops. The discipline around learning never stops. And so when you want to extend beyond your career and want to engage with the community, it first is about listening to the community. What is it that you have? What gift or asset do you have that you can actually bring to the community to solve the problem? So sometimes it is that we need the mathematical modeling and the biostatistics, etc. But equally important to that, we need the why you are willing to lend your assets to help solve the problem. Because behind that is a story to why you care enough to bring your assets to the table. And I really believe it really begins with listening. So when I engage people, and you probably have heard me say this, I ask a simple question. Based on who's sitting in front of me, what's possible? If you ask that question with every encounter, It forces you to put yourself second and the person or the situation first. It causes you to think about things that are not obviously in front of you. Examples would be, I'm seeing a patient and I see that they're overweight and they're type 2 diabetic, and I know they need to eat more fruits and vegetables. I know they need to exercise, etc. So I can write that on a prescription and I can give it to the patient. But I might want to ask, do you live in an environment that allows you to exercise and walk 30 minutes a day in a safe environment? Can you actually get this prescription filled? Do you have resources to buy the level of foods that I am thinking would help you in your quest to overcome type 2 diabetes? And so if you ask that question, forces you to put yourself second, put the person first. And I do that when I'm thinking about lending what I think are my levels of expertise to the table. First of all, is that what the community actually needs? Or do they need something else? Sometimes they just need my presence, right? Sometimes they just need somebody in my Rolodex, maybe for me to extend an introduction. But I won't know that if I don't listen first and ask the question, how can I be helpful?
Yes. And asking that question, you validate their story.
You validate it every time. Every time. Yes, every time.
So Brady is asking, well, let me say this. He is saying that, he's thankful for you sharing your amazing journey, your story. He wants to know, how do we cultivate forward thinking in ourselves and in those around us, like you had when choosing to do research for the goal of setting yourself apart in 4 years? Let me read that again. It's a compound question. So how do we cultivate forward thinking in ourselves and in those around us? And then the second part is, really building on your experience of doing this in the 4 years you have in your undergraduate, or you had in your undergraduate experience.
You know what I think sometimes, and I see this with a lot of our young people, is that they believe that they have to be perfect at the beginning. You don't. So let me just say something. I didn't wake up like this, okay? If you go back and look in the yearbook, wasn't quite this polished, wasn't always this kind, definitely wasn't always this controlled in my speaking or discipline, etc. I grew into this person because I've tried to live my values, the values that I learned in my mother's house and at church and those type of things. And so what I would say to you is, first of all, believe in yourself and don't be afraid to take risk. Because as you said earlier, failure is a part of the game. But then you get yourself back up and you learn from that failure so that how you get a little bit further the next time. When I was making this decision, you all, to go to medical school, and then when I was making this decision I went to medical school thinking I was going to be a neurosurgeon. And I did OBGYN as the last rotation in my 3rd year. And I loved the reproductive endocrinology. And part of it, you all, was because I went into the operating room and the anesthesiologist who was putting the person to sleep was a woman, and she was pregnant. The primary surgeon was a woman, and she was pregnant. The nurse assisting us was a woman, and she was pregnant. And they were playing music, and they were doing one of my favorite surgeries, a myomectomy. They were doing that. And I thought to myself, okay, I can get into this, right? Because it was an environment where I felt welcome. And so I say that to say is that there are going to be opportunities that come in your life that are going to help you chart your path, but you got to be open for them. So I had prepared to go into neurosurgery. And then I changed my mind and decided I wanted to do reproductive endocrinology. Again, remember, I was an engineer, decided I wanted to go to medical school. So again, feeling empowered, and not afraid to take risk because I believed in myself. I've always believed that I can make the best investment in myself. And so I then, in order to know that I needed to be prepared for reproductive endocrinology, great mentorship and advisement and listening to what they were saying to me.
Absolutely.
Taking that advice.
Knowing that all things are possible.
All things are possible. All things are possible. Yeah.
So we have a question that takes us a little back to the Meharry work that you've done around women's health, but has now this question is on male health. Is there a similar initiative focus on research for African American male health and African American youth health?
Yes, so there are. So there are several centers now, and we actually have one here at Morehouse School of Medicine where we focus on prostate cancer a lot and early stage and prevention for prostate cancer. A lot of them are disease focused, and so you don't see them as being as comprehensive. Meharry actually has started a male health initiative. Many of the youth health is around us really trying to circumvent some of the mental and behavior health challenges that we're seeing our youth face, particularly in this time of COVID and remote learning, etc. So there are several children's hospitals, several academic centers that do have initiatives targeted at those populations and those diseases, yes.
So can you unpack one part of your answer for me? You said that many of these programs are disease focused and so are not kind of broadly comprehensive.
Right. So when you look at something like prostate disease, African American men have a much higher rate of diagnosis and dying from prostate disease. So again, they are focusing these on disparities, right? Looking at these diseases where we see a disparity gap, a gap between based either on race or gender, etc. Yeah.
Right. Rather than the whole person and that entire experience and the collection of multiple ailments and well-being states that may be part of their story.
So one of the things that we're doing here with our prostate cancer initiative, though, is on the prevention scale, really getting people to be more engaged with their providers, right? Such that they actually, it is caught earlier, doing all of the diagnostic screening, and then informing men if they become diagnosed, what is the best treatment for them, such that they are not just taking the first thing that comes off the shelf off someone's recommendation, that they look at their lifestyle and they look at their challenges or their opportunities, and they select the best treatment for them. And the important part of it is the follow-up afterward. So creating group settings where people can have support groups and other opportunities to talk about the things that really are concerning them about the disease afterward. Yeah.
Great.
Very holistic approach to it, even though it's a disease focus.
Helen is asking, what are some steps that we can take in our own daily lives as students to familiarize ourselves with the inequities in the healthcare system?
I think that one of the things that I would first do is I tend to be a glass half full person. I think about things from a half full perspective. And then I think about, if I find a problem, how can I contribute to the solution? And so there's clearly a lot of readings that you can do. But one of the other things that you can do is to go and volunteer in a health system, at Grady or at Shore or at one of the federally qualified health clinics, and observe the experiences that people have. And ask yourself, are the differences that you see in people's experience based on some physical appearance that the person has? Is it based on something that's demographically defined? That makes it real to you. And then if the opportunity presents itself, how can you contribute positively to the solution? And it may not be that you can contribute right then. It may be some additional learnings or additional engagement that you have to have. And I have to tell this story. So I was invited to Georgia Tech to speak. A couple of years ago, I went Missouri. What was it? What happened in Missouri? I forgot the name of the racial injustice that Ferguson, when the Ferguson happened.
Ferguson, yes.
I was invited to speak there, and it was to the Black PhD and master students. And I came there speaking, and I think it was a group of the PhD students or somebody who was late for the program. And we asked, why were they late? And they were talking about chartering a bus to go up to Ferguson. Now, my mother hat came on and my reason hat came on. And I said, really? I said, so really now you are unique in that you are at Georgia Tech, getting a master's or a PhD at Georgia Tech, right? And you're talking about getting on a bus, going to Ferguson to, march or whatever. And I definitely believe in advocacy. When you get off that bus, no one will know that you're a PhD or a master's student at Georgia Tech. You will just be another person coming up there to march. And you may decrease your chances of being able to really have some impact. So here's what I would like for you to do is to stay here, get your master's or your PhD, and then be able to sit around a table and really work on some policy that can create some systemic change for
Yes.
some of the challenges that we see in our racial and social injustice.
Yes.
And so I was really, really adamant about that. And it's an and, it's not an or. There have clearly been times with our students here, we marched down to the Capitol, we did all of those things in our white coats. We kneeled for the 87 seconds. All of those things are important. But
Yes.
it is equally important that you get your degree so that you have a seat at the table where decisions are being made and change can ensue and be sustained.
Yes.
Very important.
And that sustained change is not just the kind of directed individual marching and yelling and sending your email, but it's also establishing changes in policies, changes in the systems that present choices and opportunities for us to be healthy or unhealthy, for us
Right.
to realize 3 or 4 nights in jail versus having signature bail, so you can actually go home and go to work the next day. It's
Right.
these systemic policies and structures that, are the and. It's the system and it's the individual efforts that, we need to continue to work on.
And regardless of whether we want to accept it or not, having degrees and having a voice are still aligned with one another. Being
Yes.
able to get into the door. Now, what you should not forget, though, is if you get to the table because you have a degree or because you have that credibility, always bring some other people with you who actually have more credibility because they have life experience.
Yes, absolutely. So we're getting into a question that Shashank is asking about implicit bias, and this is implicit bias in the healthcare industry. Shashank wants to know about your first experience understanding or experiencing implicit bias in the healthcare industry. And I wonder, given that experience, how did that motivate you to make a change, to do something?
I will tell you the bias that I first saw. As a second-year medical student at Harvard Medical School, and we were learning about infectious diseases. And every woman's perineum that they showed that had a sexually transmitted disease was a brown woman or a Black woman. And if that's all you saw, because that was what was pretty much in the textbooks also, you would think that Black and brown women are the only ones who got sexually transmitted disease. I lived with that for a long period of time until, of course, I said something about it. But that empowered me to really make sure that I created a platform where I helped to educate others. And again, how we have diversity shown when we're trying to educate people, and that we have diverse people in the room, particularly when we're talking about any type of disease processes that have social influence, and that's most of them. When you look at heart disease, diabetes, hypertension, etc., the reason why you see so much chronicity of that in the Black community is because of the long-standing structural and racial barriers to access to care, quality of care, access to foods, access to the conditions that allow you to exercise and have preventive health measures. It's structural. And so I have tried to live my life by recognizing those things, pointing them out, and then bringing diverse people around the table for us to create solutions.
Yes. And may I add that the work that you and I do, right, as Black women, to bring other Black and brown people around the table is not only the work that we should do. Our white brothers, our white sisters who are at those tables, who've been leaning in for a long time, need to ask the question, who is not here? And who can we bring in so we have that complete answer, that complete perspective?
Right. And Black people who are in the room with majority only, and they're the only ones there. They ask the question sometimes, why is there not someone else there? And again, you all, it's not so much always about race and gender. It is about these life experiences that unfortunately in this country align with race and gender. I don't know, I just finished with my book club. We just finished reading Caste. And so if you haven't read it, it's a very difficult read. It is a very difficult read, but we are cast into these roles based on our appearances early on. And for the generation of majority people who are now, they too have been cast, unbeknownst to them. And so when I talk to people about white privilege, etc., I try not to talk about it in a demeaning way, because many of these persons did not ask to be cast in these roles, but society put them in these roles. Now, the question is, when you recognize that you have white privilege and that it may be harmful to another group, what do you do differently to change the circumstances?
Yes. Now that you know, what will you do?
Right. Now that you know, what will you do?
So we have a question that builds from where we are here. This question the person is saying, I loved what you said about finding your likeness in a room of different people. Can you share a time, either as a student or in your professional career, where you struggled to find like-minded people and how that motivated you to be a better leader for those with an unpopular opinion?
You know, I can think about several challenging times, and I will tell you probably one of the most challenging times I had in a professional setting. I was on the FDA advisory panel when we were approving Plan B, which is the emergency contraception method, so Plan B, essentially. And I was so naive to how political this was, because I'm a scientist. I'm looking at the science. I know that what they were trying to approve through the FDA, we were already doing it in practice all the time. We did it in practice all the time. That was how we were trained, but we were trying to codify it in a way such that it would be more opportunity for women to have choice with Plan B. And there were people in the room who were so adamant against this that it was hard to find the likeness. And I had to stick to what I believed was appropriate, aligned with my values and belief and equity for women. And even though they had some loud voices and they had some stories, I couldn't find the likeness. And I had to be okay with that. There will be times when you have to agree to disagree, particularly when it forces you, if you agreed, to compromise who you are and who you are there advocating for. Because believe it or not, every time you are in a room and you are having a difference in opinion, usually about something, you may not call it advocacy, but if you were to be able to go back to the recesses of your mind, there's some experience that has allowed you to view the circumstances of the situation different than the other people. That's what cognitive diversity is.
Yes.
That's why we need diverse people in the room, because all of our opinions matter, all of them. We may not agree with each other, but you can learn from the most diverse opinions.
Yes. As you're in these challenging rooms with ideas that are being shared that just may not make any sense at all, what are some strategies that you use, that students here and faculty and our Atlanta community can use to bridge, to understand, and to try to come to, if not, a common place, at least a place where we understand one another, even when you think that, what you're hearing is just complete nonsense?
It starts with listening, which sometimes is hard. And then empathy. Empathy is really when you put yourself in somebody else's shoes. So you really try to think about it from their perspective. And then you have to ask more open-ended, non-threatening questions. And try not to interrupt people, which is hard when people are spouting out and, giving, and they really are adamant about this is the only way. And then, you go back to what we talked about. What's the why of this? Why is it that you feel so adamant about this and cannot look at it from a different perspective? What am I missing? And so it really is about having a conversation. But there are certain things, and I'm all very honest about this. There are certain things that you will not agree with someone on. And you will just have to agree to disagree, but that can always be done in an amicable way. It can always be done in that way. And again, I think also as a scientist, people have come to me with a lot of things about the vaccines. And I've been on a lot of town hall meetings and people were asking all kinds of questions, etc. And my strength has come from the fact that I can look at data, I can understand it, and I can usually discuss it in a way that meets people where they are and come up with examples to help them to understand how it works. And I think that's a welcome gift that I have from many years of trying to make sure that I was never an elitist, that I was just always fortunate to have had a very sound educational experience that prepared me to understand, but always understanding that it's not just enough for me to understand it, I need to be able to translate it to my patients so that they are still empowered to understand that it's their choice.
So with just a few minutes left, let me ask if you might consider giving us a charge. COVID is the issue of the day. And not only is it a healthcare issue, it's a life and death issue. And in particular, it's a justice issue.
Yes.
When we think about diseases, you think that, diseases are blind. But when our front line workers are in the healthcare industry, they are our janitorial staff, they are our bus drivers, they are many of the folks who are working at our grocery stores. These people are disproportionately low income, Black and brown. And so, yes, these diseases and illnesses may not have, and viruses may not have eyes, but there are societal setups that lead a certain group to be more vulnerable to being positive for the disease and dying.
Yes.
And so with COVID and these justice challenges that we're facing now, what is the charge for the almost 80 people on this call? What can they do? What must they do, given the seat and the privilege that they have?
So first of all, I would say you must continue to practice the public health strategies that we have outlined. 3 W's: washing your hands, wearing your mask, and watching your distance. And then I've added a P to it: being patient for when your time comes to get the vaccine. Remember that the vaccine does not prevent you from getting COVID. We don't know that data yet. But what it does do is prevents you from getting the disease as we define as moderate to severe symptoms. So when enough people get vaccinated, what we're going to see, you all, is a decrease in deaths, hospitalizations. Deaths, hospitalizations are going to go down. And then we will hopefully see a decrease in cases, because the data will actually hopefully begin to show that we've decreased people's viral load enough who have the vaccine that they cannot spread it to the next person. That is why we must continue to wear our mask, wash our hands, and watch our distance. And so I would say, particularly to my young people, we know that young people are asymptomatic carriers. You all have immune systems that can fight off a lot of different things, but that doesn't mean you won't pass that virus over to your grandmother or to your loved one whose immune system has changed as they have aged. To our people who are essential workers, who are out there keeping our economy going, keeping us where we get to continue to live these lifestyles that we live. First of all, I said thank you. Secondly, I say when your chance comes, please take the vaccine. I took it on television. I would never have put anything in my body that I did not believe was first safe. And when someone offers you the vaccine, hopefully we'll have 3 or 4 more that are going to come online. They are all very good. There's some data that show that one may be 95%, one may be 85%, one may be 65%. But when it comes down to preventing deaths and those hospitalizations secondary to those severe symptoms, they're all very good. So don't try to be too choosy. Raise your arm and take that vaccine. And then the last thing I will say is there are multiple clinical trials still going on. And if I was a young person who was in my 20s and 30s, if you go do that test, I think it was on New York Times, you go put your numbers in there, et cetera, you'll find out that you're about number 265 million. That's what my son, who's 25, figured out he was. And so I said to him, it's going to be a while before you get the vaccine. I would go sign up for a clinical trial. And the reason I would do that, you all, is because most of the clinical trials are weighted. The vaccine trials are weighted 2-to-1. So you have maybe 2 chances of getting the vaccine to 1 of getting a placebo. And then when they finish enrollment, which is usually only taking 3 to 6 months, they're going to break the code. If you got placebo, guess what happens? You're going to get the real thing that day. And so I would say, not only would you be helping yourself, though, you will be adding to the science, to the knowledge that we have, so that we can create the opportunity of discovery and science for everyone.
Dr. Montgomery Rice, thank you so much for being here tonight. This was a fantastic conversation, and it's I'm certain if we had the audience, they would all be snapping or clapping. So thank you so much for being here, and we look forward to all of the good work that people will do to wash hands, wait their turn, and wear their mask. And
right. And watch your distance. Watch your distance.
And watch your distance.